West Jordan, Utah. The lingering uncertainty in Congress over the fate of the Children's Health Insurance Program has left Ashley and Levi Smith torn between optimism and anxiety. As the parents of 2 young children who have relied on the government-backed health care plan, the Smiths are unsure whether they should stretch their finances to put their boys, 3 and 3 months, on a private plan or have faith that a polarized Congress will work it out. $1,200 for the 4 of us, Ashley Smith, 26, said, estimating the plan's monthly cost from their 2-bedroom townhouse outside Salt Lake City, where she crafts necklaces as part of the family business. We can't pay that and save for a mortgage, or save anything at all. Congress appears unlikely this week to reauthorize the Children's Health Insurance Program, or CHIP, which has become a crucial element in broader negotiations over how to fund the government. If no decision comes by Friday, then lawmakers are likely to take up the issue in early January, but with each delay, the pressure grows on families to find their own solutions. For the Smiths, who are Republicans, the congressional stalemate over the $15.6 billion program is bigger than a question how to pay. It is also a question of who or what to believe. Over the course of the year, their faith in the GOP-led Congress has eroded. Their general disenchantment became more pronounced when lawmakers, including even their home state senator, Orrin G. Hatch, an architect of the CHIP program, failed to secure the funding. The tangible effects of that inaction reverberated from the Smiths' home to doctors' offices and state houses across the country. 9 million children use CHIP to help lower their medical costs. The Smiths have watched their GOP representatives in Washington focus on pushing politically difficult initiatives, from seeking to rescind the Affordable Care Act to enacting a sweeping tax overhaul. CHIP is considerably more popular and, unlike many programs, enjoys bipartisan support. On television, the Smiths watched Alabama Sen.-elect Doug Jones use his nationally televised victory speech to demand funding for the program. Governors from red and blue states have pleaded with Congress, and television host Jimmy Kimmel delivered a monologue extolling the program's value. Everyone seems for it, and lawmakers insist they can get something done. Still, nothing. Jesus, bless them, said Smith, holding Aiden in her hands and thinking of her lawmakers. I am not being very nice to my government, and I have faith that one day there will be good leaders who can put all the fighting aside. But they've put themselves in such a corner that none of them can work together even when they agree. CHIP was the product of a more congenial Washington. After the failure of President Bill Clinton's health care overhaul effort in the early 1990s, the liberal Sen. Edward Kennedy, D.Mas, paired with Hatch, a conservative, to do something to reduce the number of uninsured children. The idea was to fund it through settlements and taxes from the tobacco industry. In 1997, the federal government began giving block grants to states, who in turn crafted insurance plans for working-class parents.